Howdy folks, thanks for tuning in. Just a quick video to show you how you can get enrolled in qualified health plans fast and easy here at fasteasysignup.com, where we make getting healthcare fast and easy. So here's going to be the example. Of course, you can always reach us at 800-315-0867 if you have some questions pertaining to your particular situation. So let's get started. Let's start out. We're going to ask you what your zip code is, because remember, to see if you qualify for some subsidies is going to be based on four things: where you live, your age, if you smoke, and then your income. Now, your household side has to correspond with what you are claiming on your tax returns. Okay, so if you have more than one person in your household, you want to add that person here and then modify whatever it is that they have here, if they smoke or not, and if they need coverage or not. So in many cases, some people may be married where one spouse has coverage and the other one does not. In that case, you would put down both spouses, but you would then take away the necessary coverage for that person who already has coverage if they don't need it because they're getting it somewhere else, and only have the person, obviously, that needs coverage. But you would need to have both people on there. In this case, let's just go with the simple single person who's 30 years old. And now let's move on to the income, which is going to be where you really see the difference in your tax savings or your tax credits that are given to you to apply towards a monthly premium. So if we get this income and reduce it a little bit, let's say by 15 to 15,000 annual income. Now remember, a side note, you want to get this as accurate as possible, because otherwise you will see here how the tax credit changes. And if you're getting too much tax credit when you do your taxes, there's no freebie here. You're gonna have to pay that back. So try to get this as close as possible. Let's go with 15,000 for this particular person. That means they're getting $229.43 of tax credit to be applied towards any health plan that they choose. In this case, we have our first set of health plans, which are bronze plans, which obviously are 0 monthly, but that doesn't mean that it's free. Again, I'd like to point something out for you, that what you need to pay attention to is the maximum out of pocket. Here you will see that the maximum out of pocket is $6,850, which means if anything happens to this person, they're going to be responsible for that $6,850, okay, with a $5,000 deductible. So a lot of people say, wow, that's pretty expensive. Well, it is. That's not to get political, but that's the way it works. So let's look at how we can curb that. The way you can curb that, or help see if you're going to get a little bit of a deal, is you want to look at the silver plans, because the silver plans allow you to have what is called the cost sharing subsidy attached to that plan. They're only available on silver plans, and you can see what it does is it reduces that maximum out of pocket. Also, silver plans have flat fees for specialist doctors, generic drugs, and brand names. So that's something to look at too. You can see that now you will actually be paying a little bit per month because the plans are more expensive, and perhaps your tax credit does not cover the entire amount. So that's something you'll have to look at and make a personal decision. If you do need help, like I said before, you can always give us a call at 800-315-0867, and we will be happy to answer any questions for you. So let's get back to the plans. As you can see, we're going through all the plans. Of course, you can also, if you're not getting any subsidy, you can look at the gold plans and the platinum plans as well, if you like to really compare those as well. You can see that, again, the monthly premium goes up, but the maximum out of pocket is still high again. So again, that's why we feel that in many cases you want to explore the silver plans as being your best bet. Now let's just say, for example, we're going to select Molina Healthcare for whatever reason. It's just an example. We're not pushing Molina above anybody else. All you would have to do is hit the select button and then start entering your information, basic information. Now, if there happens to be a Joe Smith out there, this is strictly a coincidence. We're trying to be as generic as possible when we do this. So again, if you happen to be Joe Smith, we apologize. We're not trying to pick on you or anything like that. You would enter your social or your phone number here, your sex, of course. We'll say Joe is a male. We'll go next, and then we'll start entering the street. Again, we want to say if we smoke or not. Believe me, you want to be honest here, because if you do have any health-related problems that are due to smoking and you say you're a non-smoker, they will probably deny you coverage. So you want to be honest here, even though it does make a difference in your premiums. Let's go ahead and continue on. You will see they're asking for household members. Again, here we could add people if we need to, and then income sources would be our next bet. So we want to add the income for the right person. So we want to pick the person. If we have more than one person, they'll come down in the drop down, and what we want to do is make sure that we have the appropriate person with the appropriate job. Now you'll see you have many different income sources that are available to you, as well as other income. So it should be good for anybody regardless of what you're doing. You want to just be able to claim what you're claiming on your tax returns. So again, 15,000. We're going to say we're self-employed. We save it. We hit next. We're going to get to our attestation, which is basically saying that we attest no one applying for healthcare coverage. You're not incarcerated. You should read some of these. This is giving us permission to work on your behalf. It tells you who we are, and also that you say who you are. We will then click this, agree, and we are almost done. And voila, you are processing, and as you can see here, we are going to be getting a Molina Marketplace Silver plan. That's how fast and easy it is. So we hope that it's going to be a good service for you. If you do have any questions, give us a call. Like I said before, we're trying to make this fast and easy for you, because we know dealing with the government has been a pain. So we hope you find some value here, and we appreciate you taking the time out to watch us. Thanks again, and have a great day.